I'm Donnie Vade. My sister Juanita works here at SaJune, and that's how I found about it, after I was sick. Well, I think a lot of women and men that come here don't know what's wrong with them when they come, but I already had a diagnosis. It took 8 months to get it, but finally Mayo Clinic in Jacksonville found out that I had inflammation of where the ligaments touch my bones was all inflamed, and had put me on a course of high dose of prednisone for probably 2 to 3 years. I was just kind of settled into the fact that I was going to be on prednisone for that long, and my sister said, well, everybody agrees that there's some autoimmune component to this. Let's see if it makes any difference. Let's run the blood tests, etc. And so I just closed my eyes and said, okay, let's try it. My first consultation was confusing in the fact that there were so many things they were testing for that had never been tested for, and so many things I've been given that they said I needed that no one had ever said that I needed before. They talked about the acidity, the pH of the body, which in regular medicine they just don't even believe in. I've been working with Dr. Pati for 2 years, and 4 months ago I was able to go off the prednisone, and the original pain and disease that I came in for is gone. Whether it would have gotten better with or without Dr. Pati, yes, that's what they predicted, but I was able to take 2/3 less prednisone than they predicted, and probably come off 6 months sooner. And the side effects to my bones, my liver, all of those things. I had a big pumpkin head from the prednisone. Just my, your self-esteem when your head's that big from the prednisone. It was amazing. So now I know that I haven't had any long-term side effects from the prednisone. But would I have had if I had to take such a high dose? The supplements and getting my body back in balance is, if I would have never gotten sick, I don't believe, because this was an autoimmune process, and Dr. Pati's theory is, yes, let's prevent an autoimmune disease from happening, whereas traditional medicine is, you have an autoimmune disease, let's treat it. And that, I think, is pretty important in this day and age where there's so many unexplained autoimmune diseases, in every part of your body, and men and women. So it's just been, in the 2 months I've just taken many pills a day, and can tell on the days that I didn't take my pills. It made that big of a difference. And nothing was prescription. I had my prescription hormone and thyroid medication, but all the others that I could absolutely tell that I didn't take, just even without taking one day. So something's out of balance. They're replacing something that I'm missing. Is it from my diet? Is it from genetics? I don't know, but I'm missing something that they're replacing that's making me feel so much better. That's where this clinic is different than a holistic healing center, because there is blood work, there is prescription medication, there is an MD degree, and nurse practitioner degrees behind everything, and they don't just say, go take these herbs and you'll feel better. The difference is, I think in holistic medicine, is they say, okay, we're going to look at your irises or something like that, and we're going to say you have issues, problems with your liver. Take these herbs and you're going to get better. Well, the problem is they never bothered to make a diagnosis. So here, there's actually a diagnosis made first before they treat you. And that is a big difference between here and just a regular holistic healing center or an anti-aging clinic, is there's medicine behind it. I say it to my own patients as an optometrist. I know you've already told me you've seen all these other doctors for this and this pain, and these other symptoms. But I'm telling you, this is different. This is putting the whole picture together.